Hi, this video is the art of hair transplant restoration surgery on a man who has a receding hairline and corner. He's balding from the front all the way toward the back. This is around a class 5, 6 hair loss pattern. And what our goal today is to establish his hairline and fill him from the front all the way toward the back. We will be attempting at least 5,000 grafts, whatever comes out. The front half going to be at least 25 to 3,000 grafts, and most likely 3,000 grafts. We're going to focus heavy dentists in the front, and we spread the 2,000 toward the back. Hair transplant, especially the hairline, is an art form. It requires a lot of artistic and aesthetic detail to ensure a very natural result. It's a lot of meticulous detail, but if you pay attention to every detail and take your time, the recreation of the hairline is very natural. And when the natural hairline is there and frame the face, it really enhances the look, the eyes, the nose, and all the features that God created for him. Bringing back 10 to 20 years of his youth back. But once you lose the hair and then the hairline gone up and then you have a bigger forehead, then people tend to look a little bit older. So from the mid-eyebrow to the hairline, mid-hairline, on average for Asian and black, around 6.5 to 7. For Caucasian, it's around 7.5 to 8.5 centimeter. For this client, it's around almost 7. And then his frontal dip right in the frontal midpoint is a little bit low, but it's natural for him because he has quite a bit of all the hair around here. So we just want to follow that. My goal is to really not change what he is, but just really recreate what he used to look like, or what he should look like as if he has no hair loss. Even like 50, 60, 70 years old, what is the highest and most natural hairline that he should have? And this is where it is. And he has quite a bit of straggler hair on both sides too. Once you get the shape down, we have a nice zigzag through. There's no hairline straight, because a straight hairline looks too artificial. And the more narrow the face, the more arched back the hairline is, the more round the face, the more flat the hairline is. And he brought some of the older picture when he was younger, so that helps too. Once we get the shape down, we will transplant at a very precise angle around 35, 45 in the front. Increases when you go backward and changes when you go different direction. And then selection of hair grafts is important, not just the precise angle. We transplant rows and rows of single hair graft in the front, followed by a root that go 2 hair, 3 hair, and 4 hair in the back for growth and volume. The goal in the front is softness and naturalness, so the hairline will look so soft and natural. The goal in the back is volume and density. So then you want to make sure that the back, that's why we try and plant a larger root with the 2 hair and 3 hair to get better density and better volume, and they give you a more fuller look. And in the front, you don't want to try and find a larger root, because otherwise it might look a little bit harsh and kind of almost artificial. So we don't want that. But that's why you can see a lot of softness in the front. So 3,000 in the front, 2,000 in the back, and I'm very excited about it for him, because he's a good-looking guy. All we need is just to have the hair and frame the face, and it will bring back the look. And hopefully next year we can film again with the before and after. The transformation going to be very drastic. As I mentioned to the client and most of my clients, you knew you had it done last year, you knew you were bald, but you forget how bald you were until we showed it before and after. So this is the art of hair transplant restoration surgery on a client with a very advanced hair loss of class 5, heading toward class 6, and we'll be attempting at least 5,000 grafts. Thank you.